Today, I thought we'd discuss the initial consult for a female with acne. A lot of people find going to a physician somewhat intimidating, so I'd like to walk you through a typical acne consult with me. As a board-certified dermatologist, and I do have training in internal medicine, I think it's important for me to get an idea of the patient's entire medical history. I also like to review diet, because there is an influence with your diet if it's very high in sugar, worsening your acne. But I usually explain to my female patients that there are really 4 distinct tracks of treatment that we can put them on. The most well-known I call conventional therapy. Now, conventional therapy includes things like topical retinoids, topical antibiotics, it includes oral antibiotics, and sometimes sub-antimicrobial agents that act as anti-inflammatories. What we do initially is start almost everyone on some combination in conventional therapy. Now, there are people that cannot take antibiotics. You may know that acne is often a co-problem with ulcerative colitis, and people with colitis really shouldn't take a lot of oral antibiotics. But we get all of that information, and we will start you on a program, typically topicals for sure, retinoids almost always, and then a combination of either oral or topical antibiotics. Now, we usually like patients to give us at least 6 weeks before they see any real improvement. I've been involved in clinical trials, and in all of the clinical trials I've been involved with for acne, the end point is at 12 weeks. But the truth of the matter is, usually by 6 weeks, we're seeing some improvement. I think it is of utmost importance to adjust the medication if you're not seeing significant improvement after 12 weeks. Now, the second track for women is a thorough investigation as to their hormonal history. There is something called hormonal acne, and for patients who have hormonal acne, we will often use a combination of topical medicines with the retinoids, but we'll add either oral contraceptives and or a drug called spironolactone. Spironolactone is a very, very interesting medication. It is used quite a bit in acne treatment, but also in all of dermatology, because it is an anti-androgen, which we can safely use in females who are not planning to get pregnant. This is why we often combine it with the oral contraceptive. But it actually blocks the action of androgens at the oil gland and improves acne that way. We will also ask questions about your menstrual cycle. Is it normal? And do you typically get a flare at a particular time of your month? Now, the third track is the use of isotretinoin, also known commonly as Accutane. Accutane is a retinoid, and it is teratogenic, which means it can cause birth defects. So it is only used in women of childbearing age who are on 2 forms of birth control pills and another form of oral contraceptive or physical barrier or something like that. But it has to be 2 forms of birth control. Now, there's a registry to verify that you have been educated by your physician as to the risks and you're going to comply with the requirements. Now, Accutane is usually used for people with very, very severe acne, acne that is scarring, and acne that has not responded to either option 1 or option 2. Now, the fourth and final option is what I call the device option. We at the Lupo Center have a number of devices that have been shown in clinical study to improve acne. And usually the mechanism by which these devices work is that the heat shrinks the sebaceous gland. Now, the problem with devices is that they're not covered by insurance, but they do offer an alternative for patients who do not want to use any type of medication in their system, and who also happen to have an element of acne scarring, because these devices, while they're improving your acne, are also improving acne scarring. And then we also, in the device category, sometimes use certain types of peels. The most effective ones for acne are typically salicylic and mandelic peels. So I think what I want you to know is the important thing in that first acne consultation is to feel that all of your options have been explained to you, that you know the pluses and minuses of each, and that you've had an opportunity to ask questions, and that you and I together can make the best choice for you.